Students that are nonverbal in our classroom all come to us with an IEP, which is an individualized education program. And so as a team, we decide on how we're going to work on their communication skills. And with some students, we use augmentative devices, like one that we used last year was a Dynavox, and they can punch in just single symbols a word that they want to say, and the device will speak for them. And with others, we use pictures that they have on a Velcro strip, and they point to certain pictures, and then we change them out through the day. And other students have notebooks that have the communication symbols that they want to communicate, and they just point to the symbols in their notebooks. Yeah, so I guess technology is really kind of a part of how we're helping our students with communication, and the iPads are wonderful, and we can program the symbols right into the iPads with the touch screens. It's wonderful, and we can change it out, and then we can also do social stories with their iPads through video, and they can watch what they're supposed to do, and then go ahead and do the activity after watching an example. A lot of the students in our room that are nonverbal, they will have somebody with them to help them use their communication booklet or their iPad and be able to interact with another person. But there are students that we've had in the past that are able to carry their communication booklet around or their Dynavox around, program it, show it, or have it speak to the person, and so they're able to communicate independently. The students in our program all are here because they qualify for the DCD program, which is Developmental Cognitive Delays. And a lot of the students in our program have autism, and some are here due to brain trauma. And some of our students have some different mental health issues, bipolar, and which was also a part. It was also with their DCD diagnosis too. And I think that it really depends on the ability of the student, their level of functioning. And I think that it could probably be looked at as equals because it's all they know. They're learning their own language, their own way of communicating. Just like a verbal student is learning their own way of communicating through their language. When we work with a student that's nonverbal, we create a program that's unique to that student. We certainly meet with a lot of therapists, we meet with speech pathologists and the whole special ed staff, and we really assess the student and make sure that we do what's best for the student. If it's going to be a picture book, if it's going to be an iPad, or if it's going to be a communication board, or there's just so many different devices out there, but we really assess the student and make sure that we're doing what's best for them. And for a nonverbal student to learn how to communicate, I think it just comes natural because everybody wants to communicate, and the more they get a response from another person, it just seems to really pick up the speed of their learning. So I think it could be looked at as equals because it is really basically their own language. If somebody would come into the classroom and want to communicate with our nonverbal students, there of course would be somebody there to assist and help in the communication. We have some students though that are very high functioning, and when they are using their devices, they can program in what they want to say, and their device will speak, and they can communicate quite well. And being nonverbal, they can hear, and so they are hearing what you're saying, and they do understand so much, pretty much everything that's being said to them. And if a student is using sign language that is just unique to them, I think that assistance would be needed right then. So it could be explained what they're saying, and they would have that help with their job coach or their assistant that's in the classroom.